So this case was about Sutter Health and related specifically to their billing practices and specifically to their billing for anesthesia services. When someone has a surgical procedure, they get a bill from their surgeon, they get a second bill from their anesthesiologist, and then they get a third bill from the hospital. Our client was an auditor for a company that had a very, very small imprint in California. Through the course of his auditing, reviewed some California Sutter bills, and then essentially came to us when he uncovered this wrongful conduct. This false bill, $3,000, was what we challenged, and at the end of the day, after a very, very long and hard-fought litigation, survived 3 demurs, 3 summary judgment motions, motions to strike our jury demand. We ultimately were able to recover $46 million from Sutter. In connection with the case, we had insurance commissioner Dave Jones, who intervened in our case because he knew that when you're having all these false bills that are going to insurance companies, ultimately it's the consumer who will pay. This case is going to affect everybody who goes to Sutter, and in Northern California, that's pretty much everybody. Prior to our case, only Sutter essentially had keys to the kingdom. As a result of the reforms and the injunctive relief in this case, that will all be public so that people can essentially understand for the first time what in fact they're being billed for.